and how we can use it for treatment of tendinitis and common problems that you have from repetitive stress or trauma. So when an injury happens, we get a whole chain of events that happens in our tissues. We, of course, get swelling, we get pain, we get muscle spasm, and we get decreased movement because of the swelling. So our big goal from treatment with ice is to help control the inflammation so that healing can begin. Ice is going to help you with several things. One is going to decrease your pain and nervous activity to that area. It's going to decrease spasm by decreasing that sensitivity. So we numb it up and we can decrease the muscle spasm. And ice permits pain-free movement. So when we numb that area and decrease the sensitivity, you can move the limb, which is going to cause normal muscle pump action through that area and then allow with normal healing, because movement heals. And number four, you're gonna reduce swelling. Swelling, when it builds up in the tissue, limits your movement. So think of it again like a water balloon, and as it starts to fill up, there's less and less movement in that tissue because it's getting tighter and tighter. So we want to bring that swelling down. Ice massage is one of the best ways that I know to treat tendinitises and these common little small area problems, okay, rather than using a big ice pack and everything. So it's very specific to that area. You'll find the tendon or the bursa or whatever is going on, and we're going to basically rub it with ice. We're going to massage it with ice. Now you can do this several ways. You can make yourself like a popsicle, basically in a paper cup, put the water in, let it freeze, tear away the top of the cup, and then you'll just rub it on that area until it goes numb. You can buy something called a cryo cup, which is kind of like a little popsicle mold for ice massage specifically, and you'll fill it up with water, wait till it freezes, and then it pops off and you have a popsicle basically that you can use. The problem with that is that it's so messy, and ice massage, when you're using it for a tendinitis, needs to be done repeatedly throughout the day, so 2 or 3 times a day. So maybe you're at work and you can't just go get an ice cube or you don't have your ice cup with you, and it's messy, you get all wet, it drips all over the place, you need towels. So what I found recently that's really helpful and something that you can take with you in a little thermal bag or lunchbox or whatever to your work or to the baseball field or to the soccer field or whatever, if you need ice, is this called the Cryo Ball. Now the Cryo Ball is a metal ball and it's filled with a gel. So you can't hear it shaking now, but there's a gel inside, and when you leave this in the freezer, it'll freeze, and you can see there's kind of some condensation on there. It just fits in this nice little container that it comes with, and it makes you this wonderful little massage ball so that you can ice massage your tendinitis or your bursitis without becoming all drenched because the ice is melting all over you. You're going to rub it directly on the skin. So if it's in the rotator cuff area, you'll find the tendon and you'll rub it right on that area until it gets numb. You're going to have to go 5 to 10 minutes until it gets numb. What's going to happen is you're going to feel a burning, tingling, and then aching probably. So it's going to burn, hurt, and then it'll go numb. You have to get to that numbness. Okay, so try to tough it out through that burning and aching and get to that numbness. So when you top it, you really don't feel anything there. Okay, so you're gonna do that 2 to 3 times a day, and you can do that every day until things start to calm down. Now, there's a big misconception that you can't use ice after the first 24 to 48 hours, but when we're treating tendinitis, we can do that. So don't let that old theory get in your head and say I have to use heat now, because we're really trying to shrink the tissue down, shrink the tendon down, and get pain-free movement in there. All right, if you can't absolutely handle the ice massage because it is intense, then you can use an ice pack or a gel pack on your area. The thing you're going to have to remember with this, because you don't want to cause frostbite with either one of these, as long as you keep it moving, you're not going to frostbite yourself. Just don't hold it directly on the area for 10 minutes. You have to keep it moving. That's why it's mobile. With the ice pack or a bag filled with ice, crushed ice or whatever, you're going to put a wet towel over your skin, then put the pack on, and then you'll secure it so it can take the shape of your arm or your limb with a bandage or ace bandage, whatever, to keep it nice and firm. And you're going to also have to keep that on for 20 minutes because it's going to take longer to get to numbness than using the direct ice on there. So that's just going to take you a little bit longer. If you're using the ice bag and you're using it on your knee, make sure that you can elevate the limb. Same thing with your elbow. If you want, you can lay down. Make sure the limb is higher than your heart. Water flows downhill, and we want to get that fluid out of there. We don't want it to stay at the same level or below because it's not going to run uphill. Okay, so those are some of the things you want to remember with that. If you try this and you really find it helpful, let me know, because I love hearing, how some of these home treatments can help. My goal with this channel and with all my teaching has been to help people be empowered to treat themselves at home when they can't get to the therapist, or they're just in a pinch and they're trying to control pain. So if you found this video helpful, give it a thumbs up and consider subscribing. I'd love to have you here, and I'd love to see you at a class. The link for those classes is down in the description box. Just hit that link. I'll show you what's going on every week with my classes, and consider subscribing, and I'd love to see you. So take care. Have a great day. Bye.